Good evening, everybody. We'll start with the today's session. Yesterday, we have finished two more aphorisms. Aphorism number 257 and 258, where Hahnemann have commented on one of the important topic, that is the favorite remedy. And he explains over there with a practice and with little bit laziness, indolence. It happens many a times that certain physicians they becomes familiar with certain group of remedies and those remedies becomes their favorite remedy. They becomes prejudiced with those remedies and they start using it on the basis of specific diagnosis. And once they start using those medicines on the basis of specific diagnosis, many a times there is a palliation or only a sometimes even no effect of the medicines at all. Unless and until we consider each patient as a new patient and we find it out the totality of the patient, specifically Hahnemann mentions over there the characteristic totality of the patient. It is not possible to judge a perfect remedy. Many times we miss a very specific similar remedy because of our favorite remedies. And that's why he commented over there, each and every case, whenever you deal, even though you have seen number of similar types of cases, you have to be very watchful, careful in finding it out, the characteristic symptoms, the characteristic totality of the patient, and then you have to find it out right. And when you do this exercise regularly, then you will going to get many remedies which are rarer also, which are not there in your pain while prescribed. And this is the important thing which he wants to highlight over there, that you should not overlook the patient, should not prejudice, should not get prejudiced, and don't overemphasize with the diagnosis. So all those things he has highlighted over there, and thereafter in the aphorism number 259, he starts explaining about more about the diet and regimen session. What one should eat, what one should drink during the treatment or when he is taking the homeopathic medicine. Every everything regarding it he has highlighted over there. So we'll learn that there are two footnotes to those two paragraphs, which are very important. Those also we have learned. We'll learn. So aphorism number 259. Considering the minuteness of the doses necessary and proper homeopathic treatment, we can easily understand that during the treatment, everything must be removed from the diet and regimen, which can have medicinal action, in order that the small dose may not be overwhelmed and extinguished or disturbed by the foreign medicinal irritants. So, first important entity or first important thing which he tries to explain over there, whenever you are prescribing any medicine to the patient, you must be careful about what the patient consumes. If he consumes something which has a medicinal value, can affect the patient's medicinal action. There are many things which can affect the medicinal action. Many patients who have the habit of using the deodorants, the strong smelling deodorants always affect the action of medicine. There are certain patients who used to use the scents and which affect the action of the remedy. There are habits of using the certain things. Certain people they used to smell certain strong smelling things that also affects the human action of the medicine. So You have to be very careful when you are prescribing a remedy, and then you should be careful what the patient consumes and what the patient utilizes. In the food, there are many items which can affect the action of medicine. One of them common is the coffee, which if you are taking the homeopathic medicine and patient is consuming coffee, yes, it definitely affects. In fact, it antidotes. Same is true with the tobaccos. All the products of tobacco, the smoking, mm, uh, snuffles, all those things affects the action of the homeopathic medicine. So when you are prescribing homeopathic medicine to the patient, you should be very watchful, careful regarding all those things, and you have to find it out exactly the diet of the patient. Because when you are prescribing, your medicine is always in a very minute quantity and minute dose. It has been potentized and diluted so much that the action can be vanished because of any minute things. And that's why it is you should be very careful regarding the diet of the patient and regarding the daily regimen of the patient. He has given one example in order to explain why it is so much necessary. There is one footnote which is there to this paragraph where he exactly mentions why it is so much necessary to find it out all those. There is footnote number 139, and what he explains over there, the softest tones of the distant flute that in the still midnight hours would inspire a tender heart with exalted feeling and dissolve it in a religious ecstasy, are inaudible and powerless amid discordant cries and noise of the day. Ecstasy म्हणजे परमानंद, discordant but सूर. So he has compared it with the soft sounds of the flute. It is from very long distance. If you are getting at midnight, it is possible because there is absolute quietness at the midnight, because of which you can listen those sounds of the flute, and you get happy because of that specific sound. But same sound is not at all audible to you in the daytime because there are many cries around you. Many types of noises are there around you, and because of which it is not possible to get the effect of that flute on you. It is as good as the homeopathic medicine. The homeopathic medicine is so minute, so mild, so gentle that the action of it gets affected because of certain small things also. And that's why he specifies that you must observe what the patient consumes, what the patient do, what patient wears, what is his regimen, everything you have, so that anything of the medicinal quality can affect the action of medicine. At the same time, many of the ingredients which are strong smelling also affect the action of medicine. The examples are given in the next aphorism. We'll finish that aphorism as well as footnote in today's session where he has given multiple examples of it. Aphorism 260. Hence, the careful investigation into such obstacles to cure in as much is so much the more necessary in the case of patients affected by chronic diseases, as their diseases are usually aggravated by such noxious influences and other disease-causing errors in the diet and regimen, which often pass unnoticed. So what he is explaining over there is the careful investigation into such obstacles to the cure. Yes, you must investigate what are the obstacles in the process of cure, and then you find it ample. Many times, the patients are having habit of using tobacco misery. Specifically in the villages, it is a quite common problem. Many patients used to smoke. Many patients used to chew the tobacco. and all those things which affect the human life and it affects the medicinal action. Even though your remedy is very perfect, it never works because of all those entities and those obstacles, which you have to be very watchful. You have to ask regarding it in detail. At the same time, what he says, specifically in patients affected with chronic diseases, as their diseases are usually aggravated by such noxious influences. Many such things aggravate the chronic disease. When the disease is chronic, such entities always aggravate the patient completely. And other disease causing errors in the diet and regime. There was one patient, just 2 days only. I took his case. And what he said, doctor, I'm having acid peptic trouble since last 10 years and it is not getting cured. I have taken homeopathic treatment, I have taken Ayurvedic treatment, I have taken allopathic treatment, but it is not working. And then at the end, he has explained himself that it might be my fault. So I asked, what is your fault? He says that I used to work continuously right from the 5:30 in the morning till late at the night and sleeps around 12 o'clock or 1 o'clock. So a person who is continuously doing sedentary work without doing any exercises, at the same time having the habits of taking the tea or coffee, and who works in front of computer for hours together, used to suffer from such type of disorder. He will not going to get cured unless and until he follow the diet and regime. Such a things are very much necessary to us. And you have to advise the patient, if you want to get cured, you have to follow specific diet and regime. Because you are getting disease because of it. And if you don't understand that, then you how can you get a cure? You will feel better when you take the medicine, but there will be a recurrence, and recurrence is the rule when the things are not followed properly. And this thing he wants to highlight over there, that there are many things which can affect the action of medicine, sometimes aggravate the problem. Other disease causing errors in the diet and regimen, which often pass unnoticed. Many times we never look towards them, but which are very essential, very important. And for that purpose, we have to be very careful. He gives many examples of it. The footnote is there, 140. See which are the which are the things which affect the action of medicine. He starts coffee, fine Chinese and other herb teas, beer prepared with medicinal vegetable substances unsuitable for patient states. The so-called fine liquors made with medicinal spices, all kinds of punch, spiced chocolates, odorous waters, and perfumes of many kinds, strong scented flowers in the apartments, tooth powders and essences, and perfumed sachets compounded of drugs, highly spiced dishes and sauces, spiced cakes and ice, crude medicinal vegetables for soups, dishes of herbs, roots, and stalks of plants possessing medicinal qualities, asparagus, asparagus means the shatavari, with long green teeth, hops, and all vegetables possessing medicinal properties, celery, onions, old cheese, and meats that are in a state of decomposition or that possesses medicinal property. As the flesh and fat of pork म्हणजे डुकराचं मांस, ducks, and the geese म्हणजे हंसाचं मांस, or veal म्हणजे वासराचं मांस, That is too young and sour viands. Viand म्हणजे मिष्टान्न. Or just as certainly be kept from patients as they should avoid all excess in food. And in the use of sugar and salt, as also the spirituous drinks undiluted with water, heated rooms, woolen clothing makes the skin, a sedentary life in close apartments, and frequent indulgence in the mere passive exercise, such as riding, driving, swinging, prolonged suckling. Sucklings are the infant breastfeeding. Taking a long siesta in the recumbent posture in their bed. So siesta is duparchi झोप. Long siesta is always harmful. It creates the problem. Sitting up long at night. Yes, again a problem. Uncleanliness. Unnatural debauchery. Debauchery म्हणजे व्यभिचार. Innervation by reading obscene books. Reading while lying down. Onanism. Or imperfect or suppressed intercourse in order to prevent conception. Subjects of anger, grief, and vexation. A passion for play, overexertion of mind or body, especially after the meals. Dwellings in marshy districts, damp rooms, penurious living. Penurious means गरीब. All these things must be as far as possible avoided or removed, in order that the cure may not be obstructed and rendered impossible. Some of my disciplines seem needlessly to increase the difficulties of the patient's dietary by forbidding the use of many more tolerably indifferent things, which is not to be commended. So see, he has tried his level best to explain everything. He has mentioned about the many things. Punch म्हणजे a sweetened drink made of fruit juices and carbonate beverages mixed with them. So such entities affect the action of medicine. Many times they are strong smelling, strong odor. Many times they are very strong taste. And these are the things which affect the action of medicine. So whenever you are treating any patient with specific remedy, you must know what the patient is consuming, what are patient's habits, what type of food he used to take. All those things matters a lot. If the patient is obese, it is your duty to tell him exactly how to reduce the weight. If the patient is having severe epigastric pain, gastritis, or severe acid peptic trouble, and if patient is consuming very spicy food or Chinese food or all those items, it is first important thing you have to ask the patient if you are able to stop those, then and then you should take the treatment. Otherwise, it will not going to work. You should be very firm regarding all those because these things are necessary part and parcel of your prescription. And that's why Hahnemann says it is not just giving the medicine to the patient with the homeopathy, but advising him everything. And for that purpose, you have to concentrate on many things. One of them is finding it out what diet the patient consumes and what is his daily regime. It matters a lot. And you have to take into consideration while taking the case, you have to go on writing down all those things regarding the habits, regarding his daily routine, regarding his daily food, what type of food he prefers, what he likes more, that all those things which are part and parcel of your auxiliary measures which you have to tell the patient. And for that purpose, case taking should be thorough enough where you can catch all those things and you can advise the patient. There was one patient who was coming to me for the severe allergic rhinitis, and he was not getting settled. So first two, three prescriptions I have given, but it was not working. And then he asked, he comes on one day. He came on one day and asked whether you have habit of using anything strong smelling, anything, any problem, any specific diet you which you used to consume. Tell me all the details. And then he was thinking, and then he asked me, Doctor, does it happen because of that tortoise? I used to use tortoise nearby bed because of the mosquito. And this was his own mm, uh, thought that it might be because of that, which he has recollected. And then I asked him, it's better to stop it for another week or 15 days and let us see what happens. And immediately when he stopped using the tortoise over there, immediately his allergic rhinitis recovered. And then the remedy worked properly. And thereafter his hyperreactions to them has stopped. So such things happens many times. So those which you have to ask the patient. There are many people who have habit of using very strong smelling deodorants, and that affects the action of medicine. Many times they suffer from the bronchitis because of it. They have long-standing coughs which never disappears. Here you must ask them that yes, I'm finding it out that you are using very strong deodorants. If you are, you have to stop. So such types of many things which you have to take into consideration when dealing with such patients. And that aspect he tried to explain in these two aphorisms and with their two footnotes. Tomorrow we'll start with the next aphorism, that is 261. So today we have finished 259 and 260, where he has concentrated about the diet and daily regimen, what to eat and what not to eat whenever the homeopathic treatment is going on. So that's all for today. Tomorrow we'll continue with the next aphorism. And we are on the part and parcel of finishing this sixth edition of Organ of Medicine. It was a big task which we have started way back, but very close to it. So we'll definitely finish it within this month or two. So thank you being there. If you have any queries, we'll have a question and answer session, or otherwise we'll conclude the session. There was one question by Dr. Prasanna. Sir, can you please explain the difference between tingling and numbness? Tingling means it is a sensitiveness which, as if some ant is going on, running on your body. It is a tingling sensation. It irritates you. Numb means the senselessness which happens to be there. In Marathi, we used to call it as a badhirone. Hindi term. Numb is where it looks like that it doesn't carry the sensations. In case of tingling, there is a sensitivity. It irritates that sensitivity, which is as if some ant is running over there, as if something is happening, just tingling over there, and it is irritating. In numb, they don't feel the sensation. That is the numb. So that is the basic difference between these two things. There is one more question by Rashi. Can long time rhinitis and asthma be cured? Yes, definitely. Why not? You have to find it out exactly what may be the reason. Is there any obstacle, or if there is no obstacle, it might be allergic rhinitis or it might be asthma. Yes, definitely. The miasm might be a psychotic tubercular, psychotubercular. If you get exactly the exact remedy, it should be cured. There is one more question. Cause is the removal of tonsil in childhood. Since then, the patient has this complaint. Yes, if you remove the tonsils, the asthma or bronchitis generally develops. But it doesn't mean that it is because of tonsillectomy. The reason is that it is because of something already disease was there. Here you have removed only the result of it. You have not removed the cause of the disease. So here you have to take into consideration the whole case and find it out exact minimum for the case. Then it definitely works. So tonsillectomy is only a superficial cause. The disease is prior to it, and that you have to treat. Tried many medicines, only temporary effect, aggravate when change in weather. You have to find it out a remedy which is based upon the miasm in such types of cases. Generally, those goes in favor of tubercular miasm. You have to catch exactly the remedy which matches the same miasm, and then it definitely will going to work in that case. Okay. Anything else? So we'll conclude today's session and we'll meet tomorrow at the same time. Thank you.